स्टार्ट को करना है
अभी जैसे मैं आपकी फोटो दिखाऊंगा तो
Good afternoon, everyone. On behalf of ENT Department, PGMR Chandigarh, I welcome you all to this academic program on public awareness on oral cancers. Professor Jayamanti Bakshi is a head neck surgeon of renown and has operated on thousands of cases of head neck cancer over the last 2 decades. She presently heads a unit at PGMR and is a keystone member of the head neck cancer management team here at PGI. I now welcome ma'am for the lecture, please.
गुड इवनिंग ऑल। जैसे हम सब जानते हैं कि अप्रैल का मंथ पूरे वर्ल्ड में हेड एंड नेक कैंसर अवेयरनेस मंथ के रूप में मनाया जाता है। तो हमने भी पीजीआई MER चंडीगढ़ में अपने डिपार्टमेंट में 17 अप्रैल 2023 को हेड एंड नेक कैंसर अवेयरनेस प्रोग्राम किया और ये दिन पूरे वर्ल्ड में हेड एंड नेक कैंसर के रूप में मनाया जाता है। जैसे हम जानते हैं कि हेड एंड नेक कैंसर या मुंह या गले का कैंसर बहुत ही कॉमन कैंसर है और इंडिया में ये कैंसर सबसे ज़्यादा कॉमन है। इंडिया में ये कैंसर इस समय 3rd नंबर पे हैं और मेल्स में ज़्यादा हैं। ये कैंसर जानलेवा है और हमें ये पता होना चाहिए कि इसके क्या क्या कारण है, क्या क्या लक्षण है, कितने लोग इस कैंसर से पीड़ित हैं और इसके लिए क्या क्या इलाज उपलब्ध हैं। नेशनल कैंसर रजिस्ट्री के आंकड़े अगर हम देखें तो इंडिया में सबसे ज़्यादा इंसिडेंस हेड एंड नेक कैंसर का नॉर्थ ईस्ट में है, जहां 1 in every 4 person कैन हैव कैंसर। नॉर्थ इंडिया में दिल्ली में 1 in 6 मेल्स एंड 1 in 7 फीमेल्स हैव बीन predicted to have कैंसर ऑफ हेड एंड नेक रीजन। माउथ कैंसर यानी ओरल कैंसर, जिसे मुंह का कैंसर भी कहते हैं, हमारे देश में सबसे ज़्यादा है और इसका इंसिडेंस इंडिया में 30 per 1 लाख पॉपुलेशन है, जबकि बाहर के देशों में 6 per 1 लाख पॉपुलेशन वेस्टर्न कंट्रीज में पाया गया है। पीजीआई MER की अपनी कैंसर रजिस्ट्री है, जिसमें 2012 से 2016 के आंकड़ों के अनुसार पीजीआई में टोटल 30,218 कैंसर पेशेंट्स रजिस्टर हुए, जो कि नॉर्थ इंडिया में सबसे अधिक संख्या है। और इसके बाद 2nd नंबर पे दिल्ली में BR अम्बेडकर कैंसर इंस्टीट्यूट में जो रोटरी कैंसर हॉस्पिटल है, वहाँ 26,420 कैंसर पेशेंट्स रजिस्टर हुए। अगर हम पूरे कैंसर देखें, बॉडी में कौन कौन सी पार्ट में कैंसर हो सकते हैं और उनकी क्या क्या इंसिडेंस है। मेल्स में लंग कैंसर सबसे ज़्यादा कॉमन है, जिसका इंसिडेंस 10.5% है। 2nd नंबर पर माउथ कैंसर एंड टंग कैंसर, जिसका इंसिडेंस टोटल अगर मिलाएं हम तो 14% के करीब है। लैरिंजियल कैंसर भी हो सकता है, 5% इंसिडेंस। प्रोस्टेट कैंसर 5% एंड इसोफेजियल कैंसर 4.2%। इन फीमेल्स द मोस्ट कॉमन कैंसर इज ब्रेस्ट कैंसर, जिसका इंसिडेंस बहुत ज़्यादा है, 27.8%, फॉलोड बाई सर्वाइकल कैंसर, गॉल ब्लैडर कैंसर, देन ओवेरियन कैंसर। टंग कैंसर फीमेल्स में 2.2% ही है इंसिडेंस। तो कैंसर से रिलेटेड जो डेथ्स होती हैं उनमें भी हमारे पास काफ़ी डाटा है एंड दिल्ली में कैंसर रिलेटेड डेथ्स 29% पाई गई, जिसको मॉर्टेलिटी बोलते हैं, कैंसर रिलेटेड मॉर्टेलिटी। पंजाब में पटियाला डिस्ट्रिक्ट में 56% मॉर्टेलिटी कैंसर के कारण दिखाई गई है। मुंबई में 59% मॉर्टेलिटी रेट है एंड सबसे ज़्यादा वर्धा में है, जो कि 65% है। तो आंकड़ों के अनुसार ये भी पाया गया है कि हेड एंड नेक कैंसर मोस्टली पेशेंट्स 76% ऑफ द पेशेंट्स एडवांस्ड स्टेज में इलाज करवाने आते हैं और इस स्टेज में इलाज करना काफ़ी मुश्किल है, क्योंकि इस स्टेज में अगर हम बेस्ट ट्रीटमेंट भी पेशेंट को देते हैं इन दी फॉर्म ऑफ मेजर सर्जिकल रिसेक्शन फॉलोड बाय रेडियोथेरेपी एंड कीमोथेरेपी, उसके बावजूद भी रेकरेंस होने के चांसेस 30 to 40% होते हैं, क्योंकि ये कैंसर स्टेज 3 एंड स्टेज 4 में बॉडी के दूसरे पार्ट्स में स्प्रेड हो जाता है, जैसे कि मुंह से कैंसर गले में चला जाता है, लिम्फ नोड्स में जाता है, जो गले में लंप या कोई गठली बना देता है, और ये लंग्स में भी जा सकता है, लीवर में जा सकता है, बोन्स में जा सकता है, ब्रेन में भी जा सकता है। तो इस स्टेज में, एडवांस स्टेज में रिकरेंस होने के चांसेस काफ़ी ज़्यादा है। और क्योंकि इस कैंसर का मेन जो रीज़न है वो है टोबैको स्मोकिंग, टोबैको च्यूइंग, अल्कोहल, ये सारी चीज़ें फील्ड कैंसराइजेशन करती हैं। मतलब मुंह में कैंसर एक पार्ट से दूसरे पार्ट में माइक्रोस्कोपिक रूप में स्प्रेड होता है, जो कि बाद में रिकरेंस के रूप में हमें दिखता है। तो हम इस कैंसर को कैसे कंट्रोल कर सकते हैं? सबसे पहले मैं कैंसर के मुंह और गले के कैंसर के लक्षण बताना चाहूँगी। मोस्ट कॉमन सिम्टम जो होता है पेशेंट में, मुंह में छाला होता है। पेशेंट बोलते हैं कि मुंह में छाला हो गया, जो किसी भी मेडिसिन से ठीक नहीं हो रहा है, या कोई वाइट पैच है या कोई रेड पैच है जीभ के ऊपर, साइड में, मुंह के साइड में, तालू में, और जीभ के नीचे भी हो सकता है ये कैंसर। सो ऐसा कोई छाला जो बहुत ज़्यादा दर्द करता है, ठीक नहीं हो रहा है किसी भी मेडिसिन से, ये सबसे पहला लक्षण है मुंह के कैंसर का। बाकी लक्षण जैसे खाना खाने में दर्द होना, निगलने में दर्द होना, चबाने में दर्द होना, या सांस लेने में दिक्कत होना, या आवाज़ बदल जाना, ये भी मुंह और गले के कैंसर के लक्षण है। पेशेंट को गले में, नेक में कोई गांठ दिखनी, या कोई अचानक से कोई लंप दिखता है, वो भी मुंह और गले के कैंसर का एक लक्षण है। तो कैंसर से बचाव कैसे किया जाए और इसको हम कैसे जल्दी इसका पता लगा सकते हैं और इसको कंट्रोल कैसे कर सकते हैं, इसके लिए हमें काफ़ी फैक्टर्स देखने पड़ते हैं। और मैं आपको कुछ स्लाइड्स दिखाऊंगी जिसमें कि हम ये जान पाएंगे कि क्या क्या तरीके हैं इसको रोकने के और जल्दी ट्रीटमेंट करने के। स्लाइड शो प्लीज। नेक्स्ट। So, month of April is celebrated as Head and Neck Cancer Awareness Month all over the world. एंड अप्रैल के महीने में जगह जगह ओरल कैंसर स्क्रीनिंग के कैंप लगाए जाते हैं, ओरल कैंसर स्क्रीनिंग के प्रोग्राम किए जाते हैं बाय ENT सर्जन्स, डेंटल सर्जन्स एंड हेड एंड नेक सर्जन्स. So oral cancer is on the rise, as we see from this slide, and that's why April is celebrated as Oral Cancer Awareness Month. So it is a silent killer and everyone is at risk. This is the data from USA, and it shows the oral head and neck cancer facts. From this data we can know that every year 4,50,000 cases of the cancer are detected all over the world, and most of these patients are in late stage of the cancer. 50,000 people are diagnosed each year in the United States with head and neck cancer, and 9,750 people will die from oral cancer every year. One person dies from oral cancer every hour, or 14 persons die in 14 patients can die of this cancer in 1 hour, according to some other data in our country. And 43% of the people who develop this oral cancer, they don't survive beyond 5 years. On the other side of the picture, we can see that it is 2 times more common in males as compared to the females. And in US, fastest growing segment of oral cancer is the population, younger population less than 50 years, who are non-smokers. And cause for this increase of oral cancer in younger people is due to increased incidence of the human papilloma virus in these countries. The risk factors for oral cancer are alcohol, tobacco, exposure to HPV or human papilloma virus, which is sexually transmitted, and other conditions like poor nutrition, poor diet, infectious diseases which lower the immunity of the body, poor oral hygiene and chronic physical trauma by dentures or sharp teeth can also lead to oral cancer. This is the report of National Cancer Registry Program in India, and it shows the population and cancer incidence in various parts of India. And this is showing cumulative risk of developing cancer at any site in the body in 0 to 74 years of age in 28 hospital-based cancer registries under the National Cancer Research Program. And in males, there is highest risk of cancer in males has been found in Northeast India, and here we can see that it is one in 4 males have the risk of cancer, and 1 in 4 females has the risk of cancer in any part of the body in Northeast. Second highest number is seen in North India, where we can see that 1 in 6 males and 1 in 7 females can have cancer at any time during their lifetime. And then it is followed by other parts, like in South India, incidence is 1 in 7 in males and 1 in 6 in females. In East, incidence is slightly lower, 1 in 10 males and 1 in 11 females. In the western part of India, incidence has been found to be still lower, 1 in 23 males and 1 in 19 females have risk of developing cancer. This table shows the number and relative proportion of new cases reported for all sites of cancer in 58 hospital-based cancer registries in India, and this data is for North India only. And here we see that in PGI MER Chandigarh from 2012 to 2016, total 30,218 cancer patients were registered, followed by Shere Kashmir Institute had 16,297 cases, and second highest number was from BR Ambedkar Institute Rotary Cancer Hospital in New Delhi with 26,420 cases of cancer. The other cancer registries are Shere Kashmir Institute of Medical Sciences Srinagar with high number of cancer cases, 16,297. Regional Cancer Center at Allahabad also reported 13,804 cases. This is the report of National Cancer Registry Program from 2012 to 2016, and there is projection of cancer cases in India for next 5 years till 2025. So from this table we can see that cancer burden by broad anatomical sites of cancer has been shown here, and from this data we can show that at all sites number of cancer cases in 2020 were 13,92,179, and in 2025 these cases will increase to 15,69,793. Tobacco related cancers are at the highest number with 3,77,830 in 2020 and 4,27,273 in 2025, followed by GI cancers, then breast cancer, lymphoid and hematopoietic malignancies, and central nervous system cancers. So by 2025, all cancer at all sites will increase. The number of cancer patients are going to increase, but relative increase is not that much, but number are going to increase, as we can see from this table. These are the 10 leading sites of cancer in the body according to the National Cancer Registry data from 2012 to 2014, and this data is for Delhi NCT. Here we can see that among males, lung cancer is the most common cancer with 10.5% incidence, followed by mouth cancer, then prostate, tongue cancer, laryngeal cancer, non-Hodgkin's lymphoma, then other cancers like urinary bladder cancer, esophageal cancer, gallbladder, and brain cancer. If we take mouth and tongue cancer together from this data, so this cancer scores highest number. It becomes around 14%. And in females, breast cancer is the commonest with incidence of 27.8%, followed by cervical cancer, then gallbladder cancer, ovarian cancer, uterine cancer, lung cancer, NHL, esophageal cancer. Tongue cancer is lower in females with 2.2% incidence. This is the report of National Cancer Registry Program, and it shows cancer mortality in various parts of India. And from this table we can see that highest mortality rate has been reported from Mumbai, Wardha district, and it is 65.9%, followed by Mumbai, where the mortality rate was 59.8%, and after that in Delhi, mortality rate was reported in both sexes, it was 13.8%. In South India, Kollam district reported the highest mortality related to cancer, 45.1%. In East India, Kolkata reported 39.2% cancer related deaths, and in western part of India, again, as I told previously, Barchi rural area reported the highest mortality, 67.2%, followed by Mumbai. And in central India, Wardha reported 59% cancer mortality. This picture shows the relative proportion of clinical extent of disease in head and neck cancers. As we know that head and neck cancers are one of the commonest cancers in India, and oral cancer is commonest among all head and neck cancers. So localized disease, if we see the localized disease, it is less as compared to the locoregional disease. It means that when the patient is presenting to us, patient has the locoregional spread of the disease from oral cavity to the neck nodes, to the regional areas like lymph nodes in the neck and lymph nodes in the mediastinum, and distant metastasis can also be seen, which is highest for nasopharyngeal cancer. And among the localized disease, tongue cancer is the commonest, followed by mouth cancer or buccal mucosa cancer, and then laryngeal cancer is also common in males. The other sites are like oropharyngeal cancer, hypopharyngeal cancer. So all sites have been shown here for males. So there is high chances of patient presenting in the advanced stage of the oral cancer at time of presentation. In females, again, localized disease has been found to be less in number as compared to the locoregional disease, which means that patient is presenting in the advanced stage for all head and neck sites. Again, here commonest is mouth cancer in females, followed by hypopharyngeal cancer, then nasopharyngeal cancer. Tongue cancer is little less common in females as compared to the males, and laryngeal cancer has also been reported in females. So what are the ways for cancer prevention and control? So this picture shows us about all the risk, all the ways which can be used for cancer prevention and control. So first thing is risk reduction. As we know that there are many risk factors for head and neck cancer, among which smoking, chewing tobacco, taking alcohol, and taking unhealthy diet. These are the risk factors. So we can reduce all these risk factors. So no tobacco use, no alcohol, no initiation and cessation to be encouraged. Eat healthy diet like low in sugar, salt, low in fats, lot of green leafy vegetables, fresh fruits and legumes. So we should encourage the people to do physical activity. So daily activity should be enhanced at all levels and avoid sitting for long hours. Vaccination has also preventive role for head and neck cancer, and we can do vaccination against hepatitis B virus, and human papilloma virus vaccination is also available. Then second step is early detection of the cancer. So how the early detection can be done? It can be done by doing the screening camps in the community. So people should participate in these screening camps. for early detection of the cancer in the mouth. And once it has been detected, they should seek prompt medical advice for persisting abnormal complaints, which means that there is an ulcer in the mouth, or painful ulcer, painless ulcer, white patch, red patch in the mouth, or some lump in the neck which is not going, or if there is some difficulty in swallowing, respiratory problem. All these symptoms should not be ignored. Early treatment should be sought, and patient should comply with the treatment advised. They should follow the treatment advised strictly. And next step in the prevention and control of cancer is policy and programs which are at the level of the government. So health system strengthening is the first step which should be done at the by the government. It should be people centric. Diagnostic and treatment facilities should be available, and timely referral and follow up should be available. There should be universal health coverage for all by the government, and no one should be left behind. Community empowerment by health literacy, stigmatization, and home care should be done. Multi-sectorial actions should be done to minimize the risk, and health promotion. And health promotion should be done at all levels to include healthy lifestyles. So this is a picture of the patient who has stage 4 oral cancer in a young male patient, and site for this cancer in the oral cavity is lower alveolus. This again shows the same patient who has extensive tumor coming out of the skin. It has eroded the skin, it has eroded the bone, lower alveolus, and this is how the advanced oral cancer presents. Here again stage 4 oral cancer in a young male involving lower alveolus with extensive skin involvement. We can see that it is going inside the oral cavity and coming out of the oral cavity also into the neck and skin. And this is the Intraop picture showing segmental mandibulectomy with skin resection for stage 4 oral cancer. So you can make out how much tissue has to be removed for removing such an extensive cancer, and it causes lot of morbidity, cosmetic disfigurement for the patient, and takes lot of time for healing, and there is requirement for post-operative radiotherapy and chemotherapy in such patients to prevent the recurrence of the cancer. And we have to do, once we have resected the cancer, we have to do reconstruction. This is the defect after resection of the cancer. So this defect cannot be left as such, it has to be reconstructed so that patient can go out for his normal activities after few months. So here we have done marking for the double pedal PMMC flap, and this flap has to be used for reconstruction of this defect. So oral cancer is a sinister disease and prevention is the best cure. So April is Oral Cancer Awareness Month, and everybody should go for screening for oral cancer. And best way to detect early is, this is the simple thing which everybody can do at home. Oral cancer self exam can be done by the people themselves, and early detection is the key. So these are the steps. You can see from this picture that there are various steps how to examine the oral cavity. Remove the dentures, look for and feel inside your lips, front of your gums. Tilt your head back to inspect and feel the roof of your mouth. Then pull out your cheeks to inspect the cheeks and gums in the back. Pull out your tongue and look at the top and bottom of the tongue. Feel for the lumps and enlarged lymph nodes or glands in both sides of your neck, including under the lower jaw. And here we can see various pathologies in the oral cavity which can be seen by self-examination with a very good light. We can see erythroplakia or red and white patches of the oral tissues, or there can be simple erythroplakia or red patches in the oral tissues at any site in the oral cavity. Leukoplakia means white patches in the oral cavity, or there can be a sore or ulcer which is failing to heal and it bleeds easily on touch, or there can be abnormal lump or thickening of the tissues. There can be difficulty in chewing, swallowing. A mass or lump can be felt in the neck. Chronic sore throat or hoarseness can be one of the symptoms of oral cancer. And there can be 80 to 90% survival when the oral cancers are found at early stages of development, and if the treatment is done in early stages. थैंक यू फॉर लिसनिंग.
इसके बाद कुछ कहना है बस.
कितने मिनट्स का हुआ?
मैं बताता हूँ.